I get a lot of questions about whether someone's prostate-related symptoms are indicative of them having a higher risk of having prostate cancer. And the answer is no. Prostate cancer does eventually, when it's extremely advanced, lead to urinary symptoms, but most commonly the prostate enlargement itself is not related to having prostate cancer. Most men, as they grow, as they age rather, the prostate continues to grow. And the reason for that is because the prostate is responsive to testosterone. And as testosterone continues to act on the prostate continues to grow. So invariably, a younger man will have a smaller prostate and an older man will have a larger prostate. What is the problem with that? Why is having a large prostate a problem? Well, the bladder is basically the reservoir through, where the urine sits and accumulates until it is socially or conveniently permissible to void. Now, right underneath the bladder, the prostate is just sitting right there as if it was like a small little donut surrounding the tube that exits from the bladder and exits the body. Now, this prostate, which is like a small donut which surrounds the tube, the urethra, right at the bladder neck being the exit point. It's like a little funnel where the bladder is joining to the urethra. Well, if the prostate is sitting right there and it continues to grow, not only does it grow outwards, but it also eventually starts to compress inwards the urethra, and that compression of the urethra starts to become a problem. And some of the signs and symptoms are frequency, meaning the patient goes to the bathroom more and more frequently. You might have to go to the bathroom again an hour after you've been, just now. Say you go at 4 o'clock, 5 o'clock, you find yourself needing to go to the bathroom again. Another symptom is urgency. Urgency is when you feel like you have to go to the bathroom, it's feeling a sense of you have to go right away. So the bladder starts really sort of going into almost like a spasm. It's contracting. It really wants you to go to the bathroom and you can't hold it. When you're younger, if you have to go to the bathroom, you still can, relax and give it a few minutes and then go later. Well, with the enlargement of the prostate, if you have to go to the bathroom and, it might make you want to go to the bathroom immediately with urgency. Another one is hesitancy, is when you're about to go to the bathroom and you're right there, you're at the bathroom and you're ready to void, but it doesn't come out. So it takes a while for it to come out. That's hesitancy. It takes a while for it to come out because, again, your bladder is desperately contracting against this obstruction that the prostate is now impinging on the urethra. So that's hesitancy. Another symptom is nocturia. That's very important symptoms because that will keep you up at night. Some men go up to 3-4 times at night, and once you get up in the middle of the night to go to the bathroom, that's not good for your sleep. And if you don't get a good night's sleep, the next day you'll be tired. It'll affect your quality of life. Eventually, the bladder gets tired of contracting against this increasingly strong obstruction that the prostate is representing. And eventually the bladder tires so much that some men might have complete lack of contraction of the bladder muscle, which becomes almost defunctionalized. And some men are unable to urinate completely. So that's called urinary retention.